Hello everybody, I'm Dr. Vikram Mhaskar, a knee and shoulder surgeon from New Delhi, India, and welcome to another video. In this video, we're going to be talking about bow legs, children versus adults. How are these different? Now remember, in a lot of us, bow legs are physiological, especially Asians and South Asians. What is bow legs? Your knee is made up of three bones: the thigh bone, the leg bone, and the kneecap. The association of the thigh bone with the leg bone determines what alignment you have. If all the body weight is going on the inner side of your knee, that means when you keep both your feet together, your feet touch but your knees don't. So in children, when can it occur? It could be just physiological. When the child is born, a newborn baby, more often than not has bow legs, right? Just physiological. Number two, genetics. So if the parents are bow legged, more likely that the child has it. Number three, a very important cause in India and around the world is vitamin D deficiency. With development, kids play less outside. As a consequence, they get less sunlight, less vitamin D in their body, which is the transport for calcium into the bones. Bones become weak, they change shape, and they lead to bow legs. Fourth is certain genetic causes like diseases, etc. Blount's disease, which is a growth issue, that can lead to bow legs. Fifth, injuries during childbirth or when the child was younger, especially injuries to the points of the bone where growth occurs, which is basically the upper and the lower ends of the bone. The leg bone is notorious for this, called the tibia, the upper end of the tibia. If the growth plates where growth occurs get injured or there's excess pressure, they could lead to alterations in growth and eventually bow legs. In adults, common causes are again physiological. You could just have it, it looks like that. It could be injuries in adulthood, childhood, which have led to the bone changing its shape because it's united or malunited in a wrong shape, leading to bow legs. It could be because of osteoarthritis, aging. So as aging happens in the joints, the cartilage gets rubbed off, the joint shape changes, the alignment changes, and one could have bow legs at the end of the day. Now the important thing is, how do you determine that the individual has bow legs? So easy rudimentary test, I told you, keep the feet together, stand attention. If your feet can touch each other and there's a gap between both your knees, when you keep your knees hyper extended, meaning straighter than straight, you're more often than not a patient of bow legs. However, God doesn't make everyone the same. There's some element of bow legs in us, there's some element of knock knees in the Caucasian and African populations. However, if it's beyond a certain limit, we consider it pathological. So the perfect way of assessing this is going to a knee specialist. He gets a X-ray from the hip all the way to the ankle to see where body weight is going. If it's a degree or two off axis, it's normal. Beyond that, it could possibly have ramifications in the future. When should you think of addressing it? When you think the deformity is too much, it's affecting you psychologically, it is affecting you physically through pain, through swelling, difficulty in walking, then getting something done is very important. What is that thing? Based on how much the alignment is off the normal spectrum, you would decide to correct it. Where do you correct it? It depends on where the deformity is. If it's in the thigh bone or leg bone, more often than not, bow legs is a leg bone related problem. So what do? Wherever it is a little curved, you crack the bone, open the bone, place a plate and get it out straight. This is called a high tibial osteotomy. Very successful operation. Stay in the hospital for a day or two. You start walking the same day. You don't put weight for about 4 to 6 weeks. Then you put weight and no supports after about 2.5 months. And return to sport in about 3 months. If you don't want to go the operation way, if it's not pathological, focus on improving compensatory mechanisms. When God gives you a part, He gives you other parts to compensate for it. Most important for the knee are the thigh muscles and the hip muscles. You should do knee extension exercises, quad exercises, the muscles in front of your knee, there are 4 heads to them. Hamstrings, hip abductors, that is the muscles that take the hip or the legs away from the body, and hip external rotators during the knee exercises. If vitamin levels are low, please correct them. Take vitamin supplements, etc., like vitamin D supplements. Get your vitamin D normal, get the child's vitamin D normal, and that could to a great extent help you with the problem. Apart from that, lifestyle modifications. If it started bothering you, you don't want an operation, get your weight under control. Avoid playing or doing impact activities like jumping, running, trampoline, swimming, cycling, cross trainer, stepper are good. You could do them. If it's osteoarthritis, advanced, an elderly person with bow legs, sometimes the only option is a knee replacement surgery. Dietary, mainly focus on a healthy diet and look forward to reducing your weight. Because remember, when there's a malalignment, think about a table which has crooked legs. If you put all the weight on one side where the leg is crooked, it is going to collapse there. So reduce the load on the table, that is reduce your body weight. So the load on the knee reduces. The ability of your knee to cope with your problem increases. You could further do that by strengthening your muscles. Till the time you're deciding on your operations, painkillers in the right dosage, anti-inflammatories help. Heat pad helps to reduce pain. Ice packs also help. And physiotherapy. I hope you got enough information about the differences between bow legs in adults and children. How do you treat them? What could you do in the interim period? If you enjoyed my video, please like and subscribe to my channel, and please follow me on Instagram. Thank you.